Dystonia Warriors. How are you guys all doing today? It's a beautiful day and I'm going to give you guys information about Botox. I have this booklet and I'm going to basically tell you everything that you need to know about Botox if you feel like Botox will help your dystonia. So, and just know if I keep looking down, that's why, because I'm reading it. So, important safety information. Dystonia can cause Botox can cause serious side effects that can be life-threatening. Go to medical help right away if you have any of these problems. Anytime, like problems swallowing, speaking, or even breathing at times. So definitely keep those in mind. It's super important to know. You need to understand what's causing your dystonia, where your dystonia is at, and what placements would be good for the Botox. Like, I have Botox pretty much all over my left side of my body, from my face all the way down to my leg on my left side. So, some common symptoms of dystonia is spasming, muscle spasming, tightness, uncomfortable pulling, head turning, neck pain, head tremors or hand. So if you are allergic to Botox or what is in Botox, definitely just ask a doctor what is in there exactly, so you don't have an allergic reaction. Because up to 81% of patients with dystonia who experience most of the positions, like different positions, I don't know how to describe it, they have found out Botox does help with them. Botox is effective, and you have to get it at least every 3 months. And there's also some more side effects. You can get some dizziness, but chances are when you get the dizziness and muscle stiffness is a day or two after, or even right away after you get the Botox. But typically after, you don't feel any soreness or dizziness. But if it does continue, go tell your doctor right away. It's super important. And if you have like nerve conditions, like something to do with your nerves, definitely tell your doctor. So before your first injection, you and your doctor will discuss the treatment for your Botox therapy. Your doctor will decide of how much Botox you will need and where it should be injected. You know, like for my face and arm, my arm will need more than my leg, because if I put more on my leg, chances are that I will probably fall. So it's really important to balance. Balance is key. So for your first injection, your doctor will administer the Botox treatment by injecting the recommended dose into the affected muscles with a fine, small needle. Now, that needle, it does pinch a little bit. It's just like a flu shot needle in a sense, but you will be okay. The doctor will most likely mark with the washable pen just to make sure he hits the right place. And over time, he might remember exactly where it is. And you will also most likely have an assistant there to hold your hand or talk to you just as you're getting your Botox treatment. So after your first injection, your doctor may want to schedule a follow-up 4 to 6 weeks just to see how your first injection with Botox will do. But typically you would have to do every 3 months for the Botox injections, like I have mentioned. And also, it's very important to document everything that you have noticed. Is the dystonia helping? When it is time for your 3 months, do you notice anything different? Like, does it get more tight and painful when it's almost time up? The retreatment. You will continue to receive Botox when the effects of your last injections as soon as every 3 months. Staying with the treatment and talking with your doctor may make a difference for you. So just communicate with your doctor and they'll help you through it all. So if you guys are new for Botox, I want you guys to go to BotoxSavingProgram.com and most likely you can pay up to $0 for your Botox treatments, which is fantastic. Well, I hope you guys have a great, fantastic day, and I will see you guys on the flip side. Bye, guys.